This community update was brought to you by U-Radio. E-cigarettes and vaping are on the rise in Canada, especially among young people. A national 2022 survey shows that 6% of Canadians aged 15 and older vaped in the last month, with rates jumping to 14% for teens and 18% for young adults. As vaping becomes more common, researchers are asking an important question: what is it doing to our lungs? A third-year respiratory therapy student, Caitlin Riley, set out to find answers.
Over the summer, Nicole and I, we met and we had discussions about vaping and sort of like, the perception of vaping, especially in younger individuals. And we both kind of connected on the fact that, prevention and public health is the cornerstone of what we kind of believe in and in our practice. So we started to think, what are the effects of vaping on a young lung?
Her work earned her a Undergraduate Research Award and led her to collaborate with Dr. Nicole Brunton, an assistant professor of respiratory therapy at the College of Rehabilitation Sciences.
Trying to get at some of the early dysfunction that might be occurring as a result of vaping in young people.
Because vaping is still relatively new, researchers don't yet have decades of data. But Dr. Brunton says early signals are emerging.
We really don't have the longitudinal data yet because vaping is relatively new compared to other, cigarette smoking, for example. And so some work is being done now. There's a large longitudinal study that's being conducted called the CLOUD study. So they're, I think, now in the process of recruiting participants. So there's definitely work being done in that space. It's just, takes time.
Both researchers come from kinesiology backgrounds and say exercise testing is a key tool for identifying respiratory weaknesses. Their goal is to give the public and healthcare workers better evidence to guide health decisions. Riley says part of their motivation comes from persistent misconceptions.
We've found as we do the literature search is first the perception. I think the perception that you're not actually lighting something and inhaling smoke. You're actually inhaling a vaporized liquid. So it's vapor versus like smoke. So that's kind of the thing, is people think it's healthier that way. And then another thing too is like they've been finding that the juice that's in a vape, like the nicotine concentration is higher, or like people are having more withdrawal from nicotine compared to like a conventional cigarette.
The accessibility of vaping, being able to use it discreetly and indoors, also increases its appeal.
It's such a popular thing now, and the use, it's so easy to use. You don't need to step outside. You don't need to, you don't need to be outside for 10 minutes if you do step away.
The team is also committed to ensuring women are fully represented in their research. Riley says many clinical tools don't account for female physiology, which could lead to misdiagnoses and blind spots.
I think it's very important to also include female subjects. I also think that, it's important to either revise current screening tools to include female data, or to include female participants, like I said, within our study.
That's why their future studies will intentionally recruit balanced numbers of male and female participants. The first phase focused on reviewing existing research and testing equipment. But Riley and Dr. Brunton say this is only the beginning. Their long-term goal is to better understand the early effects of vaping on the lungs to help shape future public health recommendations.
So now it can maybe help us pinpoint weaknesses or potential areas of limitation in that system that can, help us to try to sort out what might be happening in these lungs and ultimately provide, some evidence for the public and for healthcare practitioners so that they can have make evidence-informed decisions around recommendations or around their own health when it comes to e-cigarette use.
For these researchers, it's a crucial step towards improving care. You're listening to U-Radio, where diverse voices connect. Stay tuned for more stories and insights that matter. With U Multicultural and the Local Journalism Initiative, I'm Ryan Funk.